Assalamu alaikum, dear friends. This is me, Atiq Ahmad. Today we are going to study the topic urinary stones. Urinary stones are hard, crystalline, mineral material that stick together to form small fibrils within the kidney or urinary tract. All the urinary stones, or in other words, the kidney stones, they are made of crystalline mineral materials, and they may be found in the kidney or anywhere else in the urinary tract, for example in the urinary bladder, but they are rarely found in the ureter, because ureter is the area where there is frequent flow of urine, so they seldom stick there and form stones. They can be as small as small grains of sands up to few but they may be as large as a few centimeter or more. They may stay in the kidney, or they may travel out of the body through the urinary tract. Now, whenever we drink a lot of water, so the kidney stones are seldom formed in our urinary system, because when we drink frequently water and a large amount of water, so the urinary system is continuously flushed, and in this way there are less chances of stone formation. The condition of having stone in the kidney is known as nephrolithiasis. This is the terminology used whenever there is stones in the kidney, so it is known as nephrolithiasis. Now, the teaching points. What will be the symptoms or the indications of urinary stones? So, following are the signs and symptoms of the kidney stones or urinary stones: pain in the back, belly, or side. Pain in the back, particularly in the lower back, because the kidneys are found inside the lower back. So, whenever there is kidney stone in the kidneys, so the pain is felt within the lower back, or the pain may extend up to the belly, the region below the ribs, or it may be felt on the side on the lower back. Another symptom, that is the pain or burning during urination. There may be blood in the urine. This is another symptom. And there will be cloudy or smelly urine. The urine will become a bit dense than normal. That is called cloudy urine. Or it may be smelly urine. There will be a peculiar smell coming from the urine in the case of urinary stone. There may be nausea, there may be vomiting, fever, and chills. These all are the symptoms or the indications that there is urinary stone in the urinary system. Now, chemical nature of stones. There are 5 major types of urinary stones: calcium oxalate and calcium phosphate. These are the most common urinary stones, which constitute around 70% of the total stones found in the urinary system. The steroid or infection stones, these constitute 15 to 20% of the stones, and we will discuss these in detail. Uric acid stones, these are 5 to 10%, and cystine. Cystine is an amino acid dimer of cysteine amino acid. So when 2 units of cysteine amino acid combine together, so they form cystine. And these are usually white crystalline solids which form small stones in the urinary system. Now the steroid stone or magnesium ammonium phosphate stones, these are also known as infection stones. These are basically activated by bacterial infection. That's why they are known as infection stone or infectious stone. Now, how this process occur? Whenever some bacteria, for example, Proteus, Pseudomonas, Klebsiella, Staphylococcus, Mycoplasma, whenever they colonize our urinary system, so they basically cause infection, and they produce an enzyme which is known as urease. The urease enzyme basically hydrolyze, or in other word, break down the urea to ammonium. And whenever large amount of ammonium is produced, so it will change the pH of urine. The pH of urine is usually from 4.8 to 7.5. This is the range, but usually it is in the acidic range. But whenever there is infection by these bacteria, so as a result urease enzyme is produced. Urease enzyme basically break down the urea to ammonium, so ammonium is produced, and that ammonium basically change the pH of the urine and make it alkaline or neutral. So whenever these neutral conditions arise, so what happens? Ultimately, the magnesium ammonium phosphate that will precipitate and will form small stones. Those stones are known as steroid stones or infectious stones. Now the uric acid stones, these are composed of combination of uric acid and calcium oxalate. They are normally small, they are up to 3 mm in diameter, and they may be smooth or they may be rough, having uneven surface. Now branch stone are known as stegon stone. Those stones which are branched and complicated, those are known as stegon stones. This is the first part of this lecture, urinary stone. We will study the second part in the next lecture. This is part 1. In the part 2, we will study the causes and the treatment of urinary stones. This is all about today's lecture. See you next time with the new fresh lecture, part 2 inshallah. Take care. Allah Hafiz.